Hello, everybody. This is Dr. Nate Hadley. This is the ACT Matrix Assessment video series. Here I'm going to describe how to use the ACT Matrix to assess and frame the client issue. First off, to get started with the ACT Matrix assessment, what you're going to do is you're going to draw a box and divide it up into 4 quadrants. And you'll want to leave a space in the middle, whether it's a diamond, a circle, even another square, that's up to you. But definitely leave a space in the middle. For a frame of reference, let me go around the quadrants really quick. You have quadrant number 1 down in the bottom right, that is the values quadrant. Quadrant number 2 to the bottom left, you have the cognitive fusion quadrant with thoughts and emotions. In quadrant number 3, you have unworkable action and experiential avoidance. And number 4, it's the top right. You're going to have the committed action, which are value-based behaviors. And in the very middle, we have the present moment and the observing self. Now that we've identified each of the quadrants, let's speak about how to use the matrix most effectively. One of the mistakes I made early on when I was learning the ACT matrix myself was the excitement to hurry to get through the matrix as quick as possible to share my excitement with the client. However, I've learned over the years that spending some time in each of the quadrants to really find out as much information as I can from the clients in each of the areas is most beneficial and worthwhile both for the clinician and for the client. I've found over the years that it is important to explain to the client that this ACT matrix can serve as a roadmap for treatment from here on out, meaning that each time the client returns to the session, this can be used as a way to process their previous week's events. Once clients have an understanding about the ACT matrix and how it can be used, this can then be assigned for them to apply at home while they are away from the session. That way, during the week, they can practice thinking and observing their own behaviors and processing it through the ACT matrix lens. I've seen amazing results as clients have returned and been able to explain their weeks in terms of each of these quadrants. And let's not forget one of the most important areas of the matrix, which is there in the middle, which is teaching clients to maintain a present moment focused and an observing self, being able to observe their thoughts, feelings, and behaviors without getting caught up in them. In future slides, I'll be going over the use of the present moment and the observing self as part of ACT therapy. What I found from clinical experience is the ACT matrix has 2 stages. The first stage of the ACT matrix is used to frame the issue and used as much more of an assessment tool, both for you and the client to understand what has both been happening throughout their life and is currently happening. The second phase of the ACT matrix involves teaching the skills for each of the quadrants that the clients can then use to apply to address and help manage the issues at hand. Each of the 4 quadrants will involve using the skills taught throughout traditional ACT therapy and that are drawn from the ACT hexaflex. I frequently will not teach clients about the ACT hexaflex until they've well understood the ACT matrix. The last couple of components to the ACT matrix that I would like to add are a couple of arrows, one pointing to the right and one pointing to the left. The arrow on the right represents moving toward their goals and toward change in their life. It can also be explained as moving toward a more fulfilling and meaningful life. The arrow to the left represents moving toward becoming or staying stuck. Typically, it represents what has brought them into counseling and what has caused much of their symptoms to be maintained throughout their life or throughout the current reason for seeking counseling. It can also represent moving away from personal goals and values. So there you have an overview and intro to the ACT matrix with the 4 quadrants identified, the middle area of the present moment and observing self, and then the 2 directional arrows. one going towards change and the other toward being or maintaining stuck or moving away from personal goals and values. The next video will focus on the space in the middle, the importance of the present moment, and the observing self.